Hi, my name is Jacqueline Johnson,
And I'm Kakalina Dervais.
and we'll be presenting on the topic of juvenile idiopathic arthritis.
JIA is a type of arthritis that affects the joints of the body in children aged 6 weeks to 16 years. It's the most common type of arthritis that is found in kids and teens. It is a type of autoinflammatory disease, which also creates inflammation of the hands, ankles, wrists, and elbows. However, it may also affect other parts of the bodies. This disease results in the body's immune system attacking its cells and tissues. This causes the body to release inflammatory chemicals which attack the synovium. Synovium is the fluid around the joint. Researchers are also not sure why the body's immune system attacks itself. However, heredity and environment may play a role. Some of the symptoms of JIA are joint pain or stiffness, swelling, weakness, rash, high fever, and fatigue. There are 7 subtypes of JIA: oligoarthritis, polyarthritis, systemic arthritis, posterior arthritis, enthesis-related, and undifferentiated. These subtypes are enthesis-related arthritis causes inflammation where the tendons join bones. Oligoarthritis affects 4 or fewer joints of pain, stiffness, or swelling. Polyarticular arthritis, the negative factor, affects 5 or more joints and happens in about 1 in 4 kids and teens. Polyarticular arthritis, positive factor, the type of JIA that's most like adult rheumatoid arthritis, has more risk of joint damage. Posterior arthritis is arthritis in children who also have posterius, a scaly red rash that can start behind the ears, on the eyelids, elbows, knees, or scalp. Systemic juvenile idiopathic arthritis affects the whole body and may cause fevers, rashes, and a large spleen and lymph nodes. Undifferentiated arthritis doesn't fit all of these types or fits into more than one of these types. Our patient James was diagnosed at 2 years old, had bad fevers, stopped walking, was always crying, and the doctors thought it was many different things before being dosed with JIA. He sees a rheumatologist every other month. He visits the hospital every 2 weeks for treatment. He did physical therapy at ages 8 through 12. He does aquatherapy and broke his arm in 3rd grade, resulting in nerve damage. JIA affected his arm break. He needed the transplant by the time he was 30. He takes 3 different types of medication: Actirma, intravenous infusion every 2 weeks, meloxicam, a non-steroidal anti-inflammatory drug daily. He also takes a low dose of prednisone steroid for a flare if needed. His personal life: he's a junior in high school. He's taking advanced AP chemistry. He likes being outdoors. He's a Boy Scout and he volunteers at the hospital. He is the president of Honor Society. He enjoys theater, mock trial, newspaper, and swimming. For an easier life, James thinks a support network with people who have JIA would help him in knowing other people with JIA.
When interviewing with Dr. Anne-Marie Brescia, we were able to find out more information and add to the knowledge that we had already gained, as well as more information that continued us on the right path. Dr. Anne-Marie Brescia has been practicing rheumatology for 19 years. She only takes care of 21 patients at a time, but over the course of her career, she has been able to assist several hundred patients. Juvenile idiopathic arthritis, formerly known as juvenile rheumatoid arthritis, has 7 subtypes. JRA being one of them. The overall name JRA was changed because only 5 to 10% of cases actually are diagnosed with JRA versus the other 6 subtypes. This change occurred around 10 years ago, so many people still refer to JRA as that because that was their original diagnosis. Systemic JRA is what our patient James Edwards was diagnosed with when he was 2 years old. Systematic JRA can occur in adults, but the diagnosis is called Still's disease. They are the same thing but referred to differently. It's unclear whether it's a genetic disease, but through research and experience, they don't believe that it is. We do know that arthritis and autoimmune diseases do run in families, but it is up in the air whether there is a gene that can pass it on. The treatment can vary based on the patient. Some respond to anti-inflammatories, while others require more invasive treatments such as injections and steroids, to treat the irritated joints. James is a patient that when flare-ups occur, getting in front of the issue is necessary immediately because this can cause extreme discord in the body if not taken care of. Some side effects to the treatments can include stomach ulcers and normal unpleasantness, all which can tear down one's immune system. As certain subtypes of JIA, only certain joints are affected, so as part of new developments, researchers including Dr. Brescia are in the process of developing biomarkers to detect where flare-ups will occur and which joints are at high risk of arthritis. The translation research helps with patient-physician connection. Researchers and physicians ask patients if they can use samples to help in better understanding and hopefully find a cure to JIA. The National Institute of Health helps fund some of the research along with other grants. With new developments and leaps made, there have been less patients in need of joint replacements and more going into permanent remission. Researchers are still in the process of trying to create a cure where the disease will never come back. Talking with Dr. Brescia gave us more understanding to some of the research we had done previously and was extremely helpful. As of right now, there is no cure for JIA. As of right now, there is no cure for JIA, but through research and interviews, an option to help improve the quality of life for a child or teenager with JIA would be aquatherapy regularly, or just recreational swimming. Aquatherapy is very easy on the joints because of the low amounts of pressure on them underwater. James informed us that swimming was one of his favorite recreational pastimes, and other sports often cause flare-ups for him. Aquatherapy allows for patients to be active and can help relieve some of the stress put on the joints. As a cure or treatment, through talking to Dr. Brescia, we were able to find out that they are in the process of developing biomarkers which can detect arthritis before it occurs. Patients who have family history of autoimmune diseases and arthritis, this could be an option to try and get in front of the issue before it occurs.
In conclusion, JIA, a type of arthritis and autoinflammatory disease, affects children and teens, which causes inflammation in the joints. This causes pain and stiffness in the body. This project created excitement on increasing knowledge of JIA and possible cures/treatments. We are both currently in the medical assistant pathway in our school. Jacqueline wants to secure a degree in education, and I, Kekalina, wants to attend medical school and hopes to specialize in obstetrics and gynecology.
A huge thanks to Morris for allowing Rare Disease Day to happen, Mrs. Linda Sapienza and Delaware Hosa for giving us the opportunity to research and gain knowledge about JIA, to James Edwards and the Edwards family for sharing their special story with us, along with Dr. Anne Marie Brescia for giving us her time. Finally, thank you to everyone who donated to our fundraiser for JIA. Thank you for making this experience possible. We're very excited to work with everyone on February 28th. Thank you.
Thank you.